How to manage sickle cell gallstones long-term. Imagine dealing with a condition that affects your blood and can lead to unexpected pain and health issues. If you have sickle cell disease and develop gallstones, managing them effectively is key to staying healthy and avoiding complications. Gallstones are common in sickle cell disease because the ongoing breakdown of red blood cells increases pigment gallstone formation. These stones can stay silent for a while or cause pain and other problems. The goal is to handle them carefully and prevent future issues. If you have gallstones but no symptoms, doctors usually recommend watchful waiting. This means regular checkups and ultrasound scans to keep an eye on the stones without rushing into surgery. This approach helps avoid unnecessary risks, especially since surgery can sometimes trigger sickling crises. Routine ultrasounds are simple and safe, and they can catch new stones early, especially in children and adults at risk. When gallstones cause symptoms like intense abdominal pain, nausea, or signs of infection, active treatment becomes necessary. In these cases, doctors often start with supportive care, including antibiotics and pain relief, to stabilize the patient. Once stabilized, the most common and effective long-term solution is a surgical procedure called a cholecystectomy, which involves removing the gallbladder. This is usually done using a minimally invasive technique called laparoscopic surgery, which involves small incisions and quicker recovery times. Removing the gallbladder prevents future gallstone problems and reduces the chance of recurrent pain or infections. Surgery in people with sickle cell disease requires special care. Before surgery, doctors focus on hydration, oxygen levels, and sometimes blood transfusions to lower the risk of sickling during the procedure. During surgery, close monitoring is essential, and after surgery, managing pain and preventing infections are priorities. This careful perioperative care helps reduce the chances of sickling crises triggered by stress or low oxygen levels. Long-term management also includes regular follow-up visits to check for new gallstones or related issues. Some treatments for sickle cell disease, like hydroxyurea, can decrease the breakdown of red blood cells and may help reduce the formation of new gallstones, although they are not a direct treatment for gallstones themselves. Maintaining good overall health by staying hydrated, avoiding triggers that cause sickling, and adhering to your treatment plan supports your body's ability to manage the disease and its complications. Deciding whether to perform preventive surgery on asymptomatic gallstones is complex. Some doctors consider it in specific situations, such as before organ transplants or if gallstones cause recurrent pain that complicates diagnosis. However, routine preventive removal of the gallbladder in people without symptoms is generally not recommended due to the risks involved. In summary, managing gallstones long-term in sickle cell disease involves careful monitoring of asymptomatic cases, prompt treatment of symptoms and complications, and surgical removal when necessary. Working closely with healthcare providers experienced in sickle cell disease ensures the best outcomes. Always consult your medical team for personalized advice, as each person's situation is unique. Staying proactive and informed helps you maintain your health and quality of life.